In Alexia's case, the real issue was that her heart was failing. She would have more and more difficult time walking, getting somewhere. Dr. Sue came to us and said that she felt now was the time. You've known about it in a way since her birth, but it's very hard to actually face it. When you first look at transplant, you always think about the surgeon. And then the more you learn about it, you start thinking about really the other players around it. In the end, you say you need to have both. They both need to be superb, and that's kind of how we felt very comfortable at Montefiore.
Children can have heart failure for all different reasons. As in Alexia's case, something called cardiomyopathy, which is a disease of the muscle of the heart. She was starting to become limited by her heart. She wasn't able to do the normal things that a child her age should do. And that's our clue that really this heart is starting to reach the end of its life.
In many ways, you're just hoping to delay it, and you always kind of have this hope that this really will turn out to be just a plain old cardiomyopathy and she'll be 35 when she needs a transplant, not 8.
Most of our patients are very, very, very sick when they come to us. And, you know, it's always a waiting game that's very difficult for the patient. And there's no guarantee that they're going to be transplanted.
My cell phone rang, and it was Jacqueline Moore from the transplant team. And she said, "It looks like we have a heart for Alexia." So at that point, we grabbed the bags that we had packed a year earlier and drove down to Monte.
The operating room and the anesthesiologists are getting ready to take a very sick child through a surgery that will be life-saving but has risks as you try to get that child ready for having their heart replaced. So a lot of things sort of hurry up and wait. We hurry up and then we wait for the heart to arrive.
And I'm not sure what the exact timing is, but once the plane's either in the air or lands, then they actually take you to the OR, and they take her in, and
there's always a moment in a transplant when you've taken the old heart out and you have passed the point of no return.
Each day something new great happens. So the pacemaker comes off, the blood pressure medicines come off, the chest tubes come out. You know, the first time she gives me that smile that you recognize that that's the way she smiles. And then the first time she said, "I want to go home," so.
Alexia has done extremely well from her transplant. She recovered within days. She was home within 2 weeks. And every now and then we get some brilliant pictures of her looking like she's having just a wonderful time.
We make a lifelong commitment to those children and their families to say we are going to be with you every step of the way as we watch this heart grow, as we watch you grow.
But it's not just about transplant. It's about caring for children. And you want to have the full spectrum of care. You want to have every arrow available to you in the quiver so that you can provide family-centered care.
I was reading her book about a mouse that has big ears and can talk, so it's different from all the other mice. The book is really all about being special and different. And Alexia turns to me and goes, "Dad, wouldn't it be great if there was something special about me?" And I just thought that was just so funny for a kid that had a heart transplant to kind of see that as just a normal part of her life. That was really amazing.